The death rate from the novel coronavirus that causes the COVID-19 disease varies by location, age of the person infected, and the presence of underlying health conditions. While most people who catch the new coronavirus SARS-CoV-2 recover at home, some may need hospitalization to fight the virus. And in a number of patients, COVID-19 is deadly. Scientists can't yet say for sure what the fatality rate of the coronavirus is, because they're not certain how many people have become infected with the disease. But they do have some estimates, and there is a widespread consensus that COVID-19 is most dangerous for elderly patients and those with pre-existing health burdens. More than 237,000 people have died worldwide since coronavirus surfaced in China in December, according to international media reports. More than 3,370,393 cases have now been reported in 195 countries and territories. In the United States, which has the highest toll, 64,931 people have died. Italy is the second hardest hit country, with 28,236 dead, followed by the United Kingdom with 27,510, Spain 24,824, and France 24,594. The number of recovered coronavirus patients has surged past 1 million. At least 1,070,775 people have recovered from the pneumonia illness. Europe is the worst hit continent with 137,334 deaths. A recent study of COVID-19 cases in the United States estimated a mortality rate of 10% to 27% for those ages 85 and over, 3% to 11% for those ages 65 to 84, 1% to 3% for those ages 55 to 64 and less than 1% for those ages 20 to 54. Coronavirus in England is more than twice as high among people in disadvantaged areas, according to official data published Friday. There were 55.1 deaths per 100,000 people involving coronavirus in the areas with the worst rankings for income, health, education, and crime, compared to 25.3 in the least deprived areas, according to the Office for National Statistics (ONS). General mortality rates involving all causes of deaths, including COVID-19, were 88% higher in the most deprived areas than in the least. But when looking at the impact of deprivation on COVID-19 mortality, the rate in the most disadvantaged areas of England was 118% higher than in more well-off locations. People living in more deprived areas have experienced COVID-19 mortality rates more than double those living in less deprived areas, said Nick Stripe, ONS head of health analysis. General mortality rates are normally higher in more deprived areas, but so far COVID-19 appears to be taking them higher still. The ONS figures, which analysed deaths between March 1 and April 17, confirmed London was the epicenter of Britain's outbreak. The capital had the highest mortality rate in the country, with 85.7 deaths per 100,000 people involving COVID-19. This was more than double the next highest area, the West Midlands, which includes the city of Birmingham, where there were 43.2 deaths involving coronavirus per 100,000 people. The East London borough of Newham was the worst hit, with 144.3 deaths per 100,000 people. Another factor affecting the deadliness of the new coronavirus is the quality of medical care. Already, there is evidence that the overwhelmed medical system in Wuhan, where the outbreak began, led to more deaths. The World Health Organization's Joint Mission Report from February 28 found that among 56,000 laboratory-confirmed coronavirus cases, the case fatality ratio was 3.8%. However, the case fatality ratio in Wuhan was 5.8%, while the rest of the country, spared the overwhelming bulk of sick patients, saw a rate of 0.7%. This means fewer people are likely to die if the medical system is prepared to face an influx of coronavirus patients. Indeed, in the Emerging Infectious Diseases report, the authors said that the high death rate estimates for Wuhan are probably associated with a breakdown of the healthcare system, which was overwhelmed with cases. The findings indicate that enhanced public health interventions, including social distancing and movement restrictions, should be implemented to bring the COVID-19 epidemic under control, the authors said. As the virus has spread into different parts of the world, new data has emerged. The Diamond Princess cruise ship provided a look at an isolated, well-observed population exposed to the new coronavirus. On that cruise ship, 707 people caught the virus and 6 died, for a case fatality ratio of 0.8. It takes about 6 weeks to determine whether someone with COVID-19 will recover or succumb, so the number of deaths from the cruise ship outbreak could still rise. The current ratio tops the seasonal flu case fatality ratio in the United States of 0.1%, but it is dwarfed by the 10% case fatality ratio of SARS, another coronavirus that emerged in China in 2002. However, the Diamond Princess numbers may not be representative of what happens in the rest of the world. Cruise ship passengers skew older than the general population, putting them at risk of more serious complications. On the other hand, because the outbreak on the ship was closely watched, patients had access to quick medical care.